All right, guys. Hello. Good morning. So I had something come up this week that I wanted to chat with you guys about because I thought it was a little alarming. And I figured that you guys would want to dive in and learn a little bit about this. So I had a patient this week who told me that she was looking for a new endocrinologist for her thyroid. Now, we have been working together for probably about a few months, maybe like 2 or 3 months, which in the grand scheme is not that long when you're dealing with autoimmunity or really any type of concern. So she was wondering if, okay, maybe there's another endocrinologist that has something to offer. And I said, definitely, maybe there's someone out there, right? And she had shared with me that she went for 2 separate visits, and both of them were just dismissive. And she actually said one of the endocrinologists says, there's nothing you can do for your Hashimoto's. I have Hashimoto's too. You just have to live with it. So that's really what prompted me to even come on here and talk about this topic, because I thought to myself, wow, that's the advice that people are getting, that there's nothing to do for it. And I have it too. And you should just move on with your life and not feel like anything is in your power to do. So it kind of irked me. And I wrote myself a little note whenever there's topics I want to talk about. I'm always like, okay, write a little note, circle back to this. So that's really the topic of today, is I want to talk about some of the common things that are out there. I printed a whole bunch of stuff just from Dr. Google, and it really is confusing for people if they are trying to find answers and think that the answers could live in a Western medical model where they go and they end up saying, I didn't get answers. And in fact, I don't feel better. And in fact, my dosage for my thyroid medication, which we'll talk about how that's different than having Hashimoto's or maybe connected to it. There's a couple things there. And basically I went online and I was like, wow, imagine I'm a consumer that doesn't really know these things, that I'm not formally trained in. I would feel so confused around who do I go see this, or who do I go see for this? So basically, let's take a step back just to talk a little bit about what is Hashimoto's. It's an autoimmune thyroid condition. And what happens is that our bodies attack our thyroid gland. And that attack can lead to having some symptoms and problems with how we feel. And over time, if the attack continues to happen, there are some concerns that can arise, which is really where I think the dismissiveness needs to stop, because there are a lot of concerns that can happen if this is not supported. And having autoimmune conditions, like especially Hashimoto's, can actually lead to thyroid cancers and problems with the tissue, like nodules, and even sometimes long-term cognition concerns. So to say, oh, there's nothing to do about it, you shouldn't do anything, is not the right approach, because it actually can create more havoc and more immune stress long-term if certain things and certain parameters are not supported. And so basically the body is attacking the thyroid gland. That's a conversation in and of itself, because why? Why is my body attacking my thyroid gland? There's a lot of factors that have been implicated and connected to why this happens and why this mechanism happens. And one of them, which I talk about a lot with my patients, is a really profound or a very difficult mononucleosis infection. So viruses are linked to different autoimmune conditions. And my kind of example I give to people is, imagine C19. What was the deal with that? It was respiratory, right? It went to the lung. It was a virus that went to the lung. Why do women get screened for HPV? Well, because it's a virus that can affect cervix and cause cancer. So each virus actually can go to a different tissue. And with Hashimoto's, one of the viruses that has been linked to this is EBV, Epstein-Barr virus. It's the virus that causes mononucleosis, usually when we're in our teens, 19, 20, 21. And so that is a causative agent. Immune system stress. So anybody that has had immune issues in their life, digestive issues. Digestive issues are broad spectrum a reason that somebody could turn on autoimmune conditions, because 90% of your body's ability to have a healthy immune system comes from what's going on in your gut. You actually have tissue called gut-associated lymphatic tissue. There's things in your gut that are helpful to you and are connected to your immune system. So there's no like one reason, right? If someone's like, well, what's the one reason I have Hashimoto's? There is no like one reason. There's probably a multitude: environmental stressors, toxins in the environment, viral toxins, virus exposure, and dysregulations innately in the immune system. Genetics obviously can play a role with that. So there's no one right thing. But if viruses cause connection to this, and if environmental toxins, which are linked in the research to show connection to EBV and gut issues, then why are they saying there's nothing to do? If there are things we can identify, why is that not being addressed when it comes to healing? Now, I Googled because I wanted to see what is out there. I think I'm a little bit biased because I have a different like knowledge base and a different skill set than maybe more of the conventional medical model. And I wanted to see what comes up. So for example, I just Googled, I'll just read you what I Googled. I Googled a bunch of things, but so what is a endocrinologist, and can an endocrinologist help with Hashimoto's? This is literally straight from Dr. Google. It says, our endocrinologists are doctors that specialize and are experienced in diagnosing and treating thyroid conditions like Hashimoto's. So they're supposed to be specialized in treating this, but when you go to them, they say there's no treatment for this. Now, what I think is happening is that Hashimoto's can lead to hypothyroidism, where the thyroid hormones drop down. And that's where an endocrinologist could prescribe thyroid hormones like T3 and T4. However, not all patients that have the autoimmune attack will go on to develop hypothyroidism. And hypothyroidism is a condition in of itself. Somebody can say, I have hypothyroid and I do not have Hashimoto's. They can be two separate entities. Basket one is I have hypothyroidism without Hashimoto's. Basket two is I have hypothyroidism with Hashimoto's. They're separate. They're not the same. So I think what this post is commenting on is assuming that the Hashimoto's has led to low thyroid hormone production. Maybe that's where there would be some support. So I thought that was goofy. I'm like, well, wow, I would assume if I was dealing with this, maybe I would go to my endocrinologist, but there's really nothing they do for this. They don't look at gut health. They don't look at how are you digesting your food. They don't look at processing. They don't look at viruses. They don't really look to see if any of those things are affecting you. They don't look at your vitamins and minerals, making sure you have enough vitamin D and zinc and things that support your thyroid. Iodine deficiencies are literally 9 out of 10 patients have an iodine deficiency. And a lot of people don't realize that they're not getting iodine, which is a required cofactor for thyroid hormone production and thyroid hormone conversion. So that's another thing. If someone says, why are all these thyroid conditions cropping up? Well, there's problems with our soil and with our food that also lead us to have issues with how we're getting nutrients that can help our thyroid. So that was one of the things I kind of rolled my eyes at and was like, don't love that response. Why is Hashimoto so common? That was a question that was answered. Somebody says that too much iodine in the diet may trigger people already at risk. Radiation exposure also can cause issues with your thyroid. Very rarely do people have too much iodine in their diet. I've never seen it. In 9 years of clinical practice, I've never seen iodine overload. Never, never, never. In fact, quite opposite. Too much iodine will render the thyroid inactive, which is oftentimes like a treatment for Graves' disease and people that have too much thyroid production. Too little iodine production actually creates problems with how the thyroid is making hormones. So it's a very fine line of how much iodine is required. Too much of it causes issues. Too little of it causes opposite issues. So I thought that was interesting too, because how often do people have iodine overload? So rare do I ever see it. Like, so rare. Like, I could pull 10 people randomly right now with their labs and look at their iodine and they would be so deficient. Usually about 35 units. We like it to be at least 40, 42, but most people are in the 20s or 30s, which is very, very low. Let's see. Is Hashimoto's overdiagnosed or underdiagnosed? It's underdiagnosed. Endocrinologists are doctors who have special training in diagnosing and treating systemic disorders like Hashimoto's. I do not agree with that statement by any means. They don't have any treatment. They often say there's no treatment. I'm not knocking if you have been to an endocrinologist that has helped you. I'm so happy to hear that. I'm not here to say that they don't help. I just think that there's a little misconception around what they're doing for your Hashimoto's. And there are endocrinologists that have literally told my patients, I have it too, and there's nothing you can do. And that's really where I raise my ears and say, I don't know if I love that answer. But what is the root cause? This was another just question. Inflammation of the thyroid gland. Hashimoto's autoimmune condition is an autoimmune, aka self-attack of the gland. It means that there's a malfunction in your immune system. Instead of protecting your thyroid tissue, your immune system attacks it. There is no known one cause for Hashimoto's. In fact, it is linked to many dysregulations and many problems, including environmental factors, viruses, malfunctioning in the immune system, poor diet, lack of nutrition. I mean, there's so many factors. Does Hashimoto's get worse with age? It tends to get worse with age because it's progressive. There again, why are there no conversations around what should I do then? If you're telling me I have a progressive autoimmune condition, and then you're also telling me it can get worse and lead to cancers and nodules, some people have had their thyroid removed. They've had thyroidectomies because there is a nodule that can look malignant or concerning. But then in the same statement, you're saying there's nothing I can do. Where does that leave someone? Confused AF. That's where it leaves them. Oh, okay, so I love this. This was just a Google search. As a lot of you guys know, being holistic and practicing holistic health and being in the space of functional medicine, Dr. Isabella Wentz is a pharmacist. She's known as the thyroid pharmacist, and I definitely think her content is spot on. She is a doctor who's talking about the same things I'm talking about when it comes to what other factors. She also has, I think, been diagnosed with Hashimoto's and has done a lot to work through it. But definitely her root cause approach is different than a conventional medical model approach. And there's a lot she's talking about, just like we're talking about all these other factors. There's a lot of questions people asked. What's the best thing for Hashimoto's? Should you remove your thyroid if you have it? What can make Hashimoto's worse? Can you get Hashimoto's from stress? Most people, when I ask them if their doctor talked to them about like healing, they're like, no, it was never addressed. They just said, I have Hashimoto's and there's nothing I can do. And then what ends up happening is they feel like there's nothing for them to do, so they don't do anything. So they leave the office and there's nothing that they do to help themselves. And so it actually gets worse. And if I ask people, I said, do you know your Hashimoto's can like go into remission and your thyroid can actually stop attacking, your body can stop attacking your thyroid? Do you know that that's possible? They say, no, I thought that this is something I had to live with forever. You weren't born with this. This isn't something that you were born with. This was induced environmentally or from a virus or from a mycotoxin exposure or from something in the environment, from a dysregulation of things. The thyroid gland does not work in isolation. It's connected to adrenals. It's connected to gut health. It's connected to liver. Your liver is actually where you process thyroid hormone. So having issues inside your liver, there's a lot of trauma. People that live in a state of constant trauma can turn on thyroid issues. Energetics can also affect this. If someone's too much in their masculine energy and they're doing. A lot of women, why women? Women actually have more digestive concerns than men. And also if there is an energy imbalance, that can actually create thyroid issues for women. When there's a woman that's very hyper masculine and doing it all and running a business and taking care of the kids and being a provider and really doing a lot of what I would say masculine energy things, it can actually set off adrenal issues and also thyroid issues. Stress, cortisol, that's one factor that can turn your thyroid off. So just taking thyroid hormones when someone has hypothyroidism is not enough to support them. They need to really look at their lifestyle factors as well and like how are they showing up for life and what are they doing to contribute? Not just what they're eating, not just what they're literally taking, supplements, enzymes, what their mind is thinking, right? The trauma in their body. There's a lot of factors that play a role into this. And if you ask many women that have this, Most of them are high performing. I would call them alpha women, masculine energy women, and they are oftentimes the ones that can turn on all this dysregulation in the endocrine system. I just made a post yesterday in my stories all about a repost from someone that I really love her content. And her name is I Am Mel Wells. If you saw the post, she's lovely. And she talks about motherhood and like the feminine expression of what that means and how the polarity is shifted in our culture and why that's creating an imbalance and creating disease at the cellular level, because women are being asked to do things that are innately maybe not biologically hardwired for us to step into certain positions of what our society is asking from us. Our society is very masculine, patriarchal, doer, performer-based, outcome-oriented, driven by statistics. And when a woman's in that model, the energy and the polarity in her body and the organs associated with energy and polarity can get pulled out of alignment. And so you see a lot of women with these issues because we're kind of defying the laws of life to some degree. I'm not saying you shouldn't do the things you want, and motherhood's certainly not something that calls to everybody, but there are some things that we can't ignore or deny that we find in the research. It's like saying, if you're in the sun for 14 hours, you're going to get sunburned. Whether or not you like the sun, whether or not you think, well, I like the sun and it's good for me, right? No, there's things that happen. Same thing is happening with the energy of the thyroid. Throat chakra is a lot of the connectedness to what's the energy of the neck, speaking your truth, voicing your opinion, feeling heard, feeling seen, feeling supported. So energetics also do play a role into Hashimoto's and how it affects the tissue. We don't measure trauma. We can't really measure that. It's not a measurable tool of how does a traumatic experience affect someone. So there is a lot of layers to this, is the point of the story. So if you're dealing with Hashimoto's, what I want to leave you with is there are answers. They may not be in the classic medical model. They may be. If you can find them, great. But really looking at like a full blood profile and a full thorough workup of your chemistry and your biomarkers and things like other factors that play a role, because your thyroid is connected to your blood sugar and your pancreas. Your thyroid is connected to your adrenals. Your thyroid is connected to your liver. Your thyroid is constantly talking to your gut. There are thyroid receptors in multiple glands and multiple organs and tissues. So I just want to kind of comment on that. I'm looking to see if there was any other questions or any other just like things in my Google search, which I don't really love Google as like my platform anyways. You know, there's all these companies that filter and don't put real things up there. And of course, big Google, big pharma, you know, all these big companies, big Amazon, they're all in cahoots. So I think getting health advice also from a platform that's not biased like Google is important as well. But let's see here. Anything else? Let's see if there was anything else. Someone says, can you have a normal life with Hashimoto's? Yeah, I think you can have a normal life. I just think there's going to be strategies that you're going to have to implement that are going to be more supportive. You're going to have to do things a little bit different to help you, because the symptoms of Hashimoto's are really, 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 really low energy. A lot of neck up stuff like brain fog, cognition. There is a condition called thyroid encephalitis or encephalopathies, because it's a lot of like brain fog and like, why did I come into this room again? Energy issues, fatigue issues. There's a lot of other things that cause those things as well. This can look a lot like other stressors. They can look a lot like, Hashimoto's can look like other autoimmune conditions like Sjogren's or lupus or scleroderma, mixed connective tissue disease disorder. It can look like a lot of other things, but it also can look like blood sugar issues. It's kind of like a condition where there's multiple symptoms that are involved. So the only way to really diagnose this is a thorough thyroid panel, looking at thyroglobulin antibodies, thyroid peroxidase antibodies, the antibodies to the thyroid, meaning the immune system, and then also reverse T3, free T3, total T3, and then free T4, total T4, TSH, TRH. There's a lot of factors that play a role into this. So this would be diagnosed in blood, although sometimes there are women that have what's called subclinical thyroid issues where their blood work's not showing issues yet, but their body is leaning towards saying that this could be turning into a thyroid issue. Just like if someone's diabetic. Diabetics aren't on Diabetic Tuesday. Diabetics have been pre-diabetic, aka they've been leaning towards going towards this place before they developed it. Same thing with Hashimoto's. It's not just boom, I turned it on one day. It's my body was leaning towards having concerns that brought me to this place today. It's a spectrum. It's not yes, no, in, out. You guys know I always talk about that. Health is not linear. It's not black, white, up, down, yes, no. It's not polar. It's the in the between shades. And so this is a spectrum. So if someone says, well, my blood doesn't say I have thyroid issues, well, we would call that subclinical, where maybe it's not showing yet, maybe it's not diagnosable yet, but you're showing a lot of the symptoms of having some concerns. And if there is a genetic factor where it's like my mom, my sister, my families have it, it is a matter of time likely before you start to turn on those genetics. Not that your genetics will automatically mean you develop something, but it means basically it's going to be harder for you, and you're going to have to work a little bit longer and harder to try to reverse these things that your body is genetically leaning towards. So all those factors play a little bit of role. It's usually on the maternal side, though. Genetically, with thyroid issues, it's women have this. Yes, men do have Hashimoto's, absolutely, but it's less prevalent than women having it. So if you're dealing with autoimmunity, please do not be dismissed, and please do not settle for there's nothing you can do. Go home. Don't change your life. Don't look at your food. Don't look at your diet. Don't look at your movement patterns. Don't look at how you're working in your life. That's not right. That's not right. And I don't think people should just settle for that answer. So that's really the point of this. I hope that this was helpful. I know this was a little bit of a longer video with a lot of info, but comment down below if there's something that you are interested to learn more about specifically with this condition, or need a little bit of support around with this, or have questions with, and we will keep it going. I will also post this on Facebook. And that's it. So I just wanted to share that with you guys before my day gets started here. And I will see you guys soon.